Most adults know they need an annual eye exam. But what about a baby? When is a baby's first eye exam? In this episode of OCuTALK, Dr. Michelle Barron will be discussing a baby's first eye exam, how soon the first visit should be, what to expect during that appointment, and how often young babies and toddlers should be seeing their eye doctors. Dr. Barron?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Barron. Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Everyone, please welcome Dr. Michelle Barron. Dr. Barron, thank you so much for joining us today.
Thank you so much for having me.
Well, thank you so much for taking the time out of your day to visit with us, Dr. Barron. Before we get into our conversation today, I was kind of hoping that maybe you can introduce us, introduce yourself to us. Let us know a little bit about your background and your specialty to our viewers.
Yeah, absolutely. So I'm Dr. Michelle. I practice out of Toronto, Ontario, Canada, and I've been practicing optometry for the past decade. When I first came out of school, I took a very keen interest in pediatric eye exams and went further into courses on developmental optometry and focusing on children's development and how that relates to their eyes and vision. I've since had two children of my own who keep me very busy, and I'm now a optometrist and hired mummy. So I'm also making my way into the world of ocular aesthetics, but still pediatric eye care has a really deep place in my heart.
Well, excellent introduction, Dr. Barron. You are definitely very busy. I understand that. So Dr. Barron, for our discussion today, we were hoping that maybe you can discuss with us about baby's first eye exam. And so with that, when should we take our baby to their first eye exam?
Okay, so that's a question that I get all the time from new young parents. Baby's first eye exam should be at 6 months of age or somewhere between 6 and 9 months old. Part of why we really like this age is because by that point, most of the essential visual development is done, but they're also young enough that they're not really scared of strangers yet. As we get closer to 8, 9 months, they start to make strange, and it makes our job a lot harder. So if you bring in a 6-month-old, they're not scared of us at all, and very eager to let us check their eyes and play with their eyes. And so that's why it really is an ideal age to check if there's any major health concerns or visual concerns happening at that young of an age.
Perfect information, Dr. Barron. And so what does the first eye exam typically look like?
Yeah, so again, and a lot of parents' reservation says, how can you check my baby's eyes at 6 months? They can't answer better 1 or 2, or they can't read letters off an eye chart, and we don't need them to do that. Baby's first eye exam is a lot of us looking into their eyes and looking at their eyes. So we're going to be doing some high contrast pictures to check that they're picking up the level of vision they should be picking up at that time. We're going to be shining a bunch of lights in their eyes, not too bright, but enough for us to check that the tracking of their eye is okay, that their eye alignment is okay, that the health of the front of the eye and back of the eye is okay. And we're even able to check if babies need glasses or if they need a prescription just by looking right into their eye with our special light. So we can even check for prescription without them even telling us any information whatsoever. So really simple. Often at that age, children will get drops in their eyes so that we can make their pupil larger, so we can get a really good thorough look into the back of the retina, because that's one of the most essential areas for us to check on a baby eye exam.
Well, perfect. And you actually just touched on it a bit there, but I was wondering if maybe there was any other information. But what other things are you specifically looking for during the exam?
Yeah, so at a baby's 6-month exam, there's a few essential things we're looking for. Number one, are their eyes lined up properly? We want to make sure they don't have a strabismus or a misalignment of their eye, because if that's the case, if one eye is pointing straight and the other is pointing inwards, they can start to only favor the straight eye, not use the pointed eye, the crooked eye, and then they'll end up getting a lazy eye. So a major point is eye alignment. We're also looking for healthy front and back of the eye. So there are babies that can be born with cataracts in their eyes. We want to make sure that all the surfaces of all the layers of their eye are totally clear, that they're free of any cataract or any corneal disease. And one of the most major things we're checking for is in the retina of the baby's eye that there's no sign of retinoblastoma or any cancer within the baby's eye. So that's one of the big things we check also. And then lastly, that there's no very major prescription coming through. So we can check if babies have a prescription for glasses. If it's higher than a certain level, we do need to get babies into glasses, and you'll see those like cute little baby glasses that we see on social media posted, and kids' faces light up because they can actually see. But we want to make sure children are getting the visual development they need, that they can see the world clearly enough to then develop further. And so that's one of the major things as well.
Well, excellent information there, Dr. Barron. And one question I also did have was, what are the developmental milestones that parents should be on the lookout for in regard to their baby's eyes?
Yeah, sure, absolutely. So, as a parent myself, be very careful with developmental milestones because you don't want to be comparing your children too hard and fast to these timelines. But what we should see is even as a newborn baby, they should start to really favor mom's face. So you want to sort of see them starting to favor mom's face. By about a month old, you should see them start to like smile, smirk at a face as opposed to anything else. When babies are born, they can really only see right in front of them. So they do have to be pretty close to you to start to make that smile and smirk, but you want to see that there is some level of acknowledgement at mom's own facial expression. By about 3 months, 3 to 4 months, we should start seeing babies sort of coming in with things towards their face. That's a time where eyes start to learn to converge in. So we're going to see them start to, bring their hands to their mouth or bring their hands to their face. A lot of times, grandparents or family members will say, oh, they're starting to teeth. And it's actually not that they're teething at that young an age. It's actually that they're seeing things visually, they're bringing it in, converging their eyes, and then they're exploring it with their mouth. So that's, a key developmental time also. Somewhere between 6 to 9 months, children will often start crawling. Not all babies crawl. Some of them will inchworm. But again, at 6 months, you'll see them get on their hands and knees and start to rock back and forth. That's babies starting to learn to change their gaze from up close to far away, and they're starting to see far away, and they're starting to look at targets at a distance, and that's driving them to move towards it. So those are some of the milestones that as parents we want to see to make sure they're getting visual input. So smiling around a month, maybe just past a month, starting to bring things towards their mouth at 3 to 4 months, and then that they're showing that they're trying to move towards targets, in the world. Vision drives movement. So we need our children to have clear vision to make them want to move towards things of interest.
Well, that's very interesting information. I never really thought about it that way, Dr. Barron, but very, very excellent information. We talked about it before, and we're talking about 6-month-olds going in for their first exam. I wanted to ask you, how often should we bring in our baby for an eye exam? So is it different for babies? Like I know, like for adults, it's maybe like once or twice a year, but for babies, is it different?
Yeah, great question, Nick. So first eye exam around 6 to 9 months. After that, if everything looks healthy and clear, you then want them to have another exam somewhere between the 2 to 3 year range. And after that, after 2 to 3 years old, again, if everything was clear and we're just tracking them, an eye exam just before entering kindergarten. So somewhere around 4 years old, and then annually after that once they're in grade school. So again, that baby exam, that sort of toddler, preschooler exam, and then annually once they're in grade school.
Oh, well, perfect. Excellent. Thank you for that, Dr. Barron. And so what are some signs or symptoms that kind of parents should be on the lookout for and be on alert to know that, hey, I should probably bring my child in for an exam?
Great question. So again, can't stress enough the importance of routine exams, because when it comes to vision, a lot of times kids actually trick us. They don't show that they can't see, and they don't know any differently. So it's our job as parents just to bring them for that routine exam. And so many times there are children who end up needing glasses. The parents said, I had no idea. So the best thing to do is those routine exams. But if you notice any red flags, then of course bring them in as soon as you notice them. And some of those are if you notice your child's eye turning. So if you notice their eye swinging in, or drifting outwards, that's a reason to see an eye doctor right away. If you notice they tend to want to close one eye, especially if they're sort of looking and focusing on things, that could be a sign again of a misalignment. If you notice a head tilt, so if they tend to have a certain posture where their head is tilted in a certain way, again, that can be a sign of an eye misalignment. If you end up taking pictures, we all take pictures, I shouldn't say end up, if when you take pictures of your kids, if you notice, so you know how you get like sometimes a red reflex, especially on old school cameras. If you ever notice a photo taken where one of their pupils or both, but one of them has a white reflex coming back, that is reason to bring your children in right away, because a white reflex shining through on a picture can actually be a warning sign for retinoblastoma, a very dangerous pediatric cancer. So not to set everyone an alarm and go scrolling through, it's usually it's obvious, we're talking a big white one. You can Google it if you're not sure. But any sign of that, absolutely bring them in right away.
Well, definitely excellent information there, Dr. Barron. We appreciate that. And so, are there any common conditions that arise during the first year of development that parents should be aware of?
Yeah, so the most common baby pediatric issue with their eyes is actually a blocked lacrimal duct. So what that is when the drainage tube that drains our tears is narrow and can get a little blocked on babies. And so this is the most common baby problem we'll see. And that's that the eye is always watery. It can get goopy because the tears aren't draining properly, so bacteria can build up. And if you notice that, bring them into an eye doctor. They will give you advice on what to do to help to make it better. It typically resolves by the time a baby is 1 year old. Then if it's not resolved by then we're looking at surgery as an option to open it up. And you want to really work to sort of massage it open. And sometimes antibiotics is needed if it is getting infected. So that's a very common one, but do speak with your eye doctor to find out how to have that managed and treated within the first year. Other baby problems, again, not as common, but if they do arise, they do have to be addressed, is if the baby's eyes are turning. It's normal for babies' eyes to turn in the first few months of life, just like when they go to like reach for something and they miss and they overshoot, they're learning how to use their muscles, and their eye muscles are not yet coordinated. But by 6 months, their eyes should be resting straight. So if by 6 months you're still noticing that eye is swooping in towards their nose, especially, or drifting out, then again, a big red flag to bring them in for an eye exam, because that could be congenital esotropia, and that might require surgery in early years of life.
Well, again, awesome information, Dr. Barron. Thank you so much. And another question that I had is about, are there any like eye care routines or like cleansing processes that maybe parents should be aware of to kind of help with that routine to make sure that they're keeping up with everything with their baby's eyes?
Yeah, baby's eyes are fairly low maintenance. You can, again, when baby's in the bath, is just do a nice warm wash around the eye to get rid of any debris. If they do have a lacrimal drainage problem, then that will take a lot more care. You'll want to be using a warm washcloth quite regularly to wipe everything away. And again, sometimes antibiotics, sometimes even breast milk is a really great option to keep their eyes clean. But again, speak with your eye doctor on how to best utilize that before you start putting breast milk into your baby's eyes. But there are certain cases for that as well. And just a really gentle, warm washcloth. But if you're seeing more debris, more buildup, any redness or goop, do see your eye doctor again, because there are great antibiotics that can be used on the pediatric population. And often antibiotics aren't even needed, but just knowing the right steps to take.
Well, awesome, Dr. Barron. And another question that I did have is, are there any new technologies or developments in not only just the eye care horizon, but maybe in the pediatric realm that we should probably be on the lookout for?
Yeah, I mean, technology is coming out in eye care so quickly. We're really blessed with so many great things. It's now easier than ever to sort of get in and get out and check a baby's eyes really quickly. We have great ways that can sort of automatically take measurements of babies' eye prescriptions with different auto refractors that are meant for the pediatric population. We have great, lights and headlamps that we can look into their eyes really quickly and easily to get that really full view, so that eye exam itself is getting easier and easier to do a really efficient, deep investigation of their eye. We're also seeing great technology when it comes to baby glasses and frames. And the technology on that front. So if your babies or children do need glasses, they're so much cooler than they used to be. They're so much more durable than they used to be. So we're really getting lucky with what's out on the market now in the baby and kids world. Same with sunglasses. There's great sunglasses out, and all of our children should be wearing sunglasses outdoors. So that's an important one to remember.
Well, definitely be on the lookout for that, Dr. Barron. And before we leave today, was there anything else that you'd like to let our audience know about?
I think it's really just the importance of bringing your children for eye exams. I think it's an area that we often forget as busy parents on the go, but so essential for so many parts of their development. So do remember that, baby 6 to 9 month eye exam. And then after that, those annual exams between, 2 to 3 years old and older, because children trick us. We don't know what they can't see, and they don't know that it's an issue. So making sure they're being checked, that we find problems as early as possible, that we can do early intervention to make sure they have the best visual development academically and for sports and even socially. It plays such a big role and factor there. So bring them in. Don't just assume.
Well, excellent advice there, Dr. Barron. And as a parent, I do know that my kids can trick me too. But thank you so much, everyone. That was Dr. Michelle Barron. Dr. Barron, thank you so much for joining us today.
Thank you so much for having us today, Nick.